Hi, my name is Ryan Yonda, and this presentation will define and provide examples for concepts introduced in Module 1. The first one is disease, which is a disruption to a structure in the body which causes a reaction. An example of this is provided on mayoclinic.org. Cardiovascular disease, which is a type of disease affecting the heart or blood vessels, can be caused by a buildup of fatty plaque inside the arteries. The disease classification provided by the World Health Organization is known as the International Classification of Diseases, or ICF or ICD, and this provides a list of codes for various diseases and injuries that does not have a language barrier. So many countries use this to provide reports on their injury and disease. An example of this is PJ00, which is used for victim of lightning, and 6B40, which is used for PTSD or post-traumatic stress disorder. Etiology is the study of causes of diseases. This is recognized by various agents such as biologic agents, physical forces, chemical agents, genetic inheritance, and abnormalities in nutrition. An example would be chronic traumatic encephalopathy, or CTE, which is commonly suffered by football players who have repetitive brain trauma from strikes to the head area. Pathogenesis is biological mechanisms of disease developing from infection to bodily reaction. And essentially, pathogenesis defines the lifeline of a disease from beginning to end. An example of pathogenesis for tuberculosis, which is provided on ccn.aacnjournals.org, defines the path of infection as vapors infected with the TB bacteria being inhaled by the patient. Once it passes through the mucous system, macrophages engulf this bacteria, and defense mechanisms fight to keep the bacteria latent or inactive, but a weaker immune system may cause a progression to active TB, which has the symptoms of coughing up blood, chest pains. Any exposure to the TB bacteria can be confirmed through a TB skin test as well. Symptoms of a disease is evidence only observed by the patient or explainable by the patient, such as a headache. A sign is observed by a healthcare professional through tests or inspection of the patient, such as a skull fracture observed via an X-ray. A syndrome is a combination of signs and symptoms which indicate the presence of a specific disease. An example of this through nichd.nih.gov is Down syndrome, which carries physical indications such as a flattened facial profile, or developmental symptoms such as impulsive behavior. Diagnosis identifies a disease through signs and symptoms, hereditary background, and external sources. For example, depression can be diagnosed through symptoms such as suicidal thoughts, consistent thoughts of worthlessness or guilt, and also insomnia. Complications can arise from disease. These are known as secondary conditions caused by one primary disease. An example would be heart disease, which can arise in patients with kidney disease due to the fact that kidneys are not functioning properly or able to support the body as they normally would. A statistic on kidneyfund.org states that heart disease is the leading cause of death for patients with dialysis or on dialysis. Prognosis is the most likely outcome and chance of recovery from disease, depending on the various treatment options available. An example would be on medicinenet.com, HIV patients can expect progression to AIDS within 10 years and then 3 years for survival after that point. However, with treatment, a young patient with HIV can expect to live for several decades as long as they stick to their regular treatment schedule. And finally, diagnostic media is a type of medical test used for determining a patient's disease. Examples would be X-ray or blood tests. So that would be a list of concepts defined in Module 1. This is Ryan Yonda.